FUSE stands for Frequent User Systems Engagement. And that is for, clients that frequently use the emergency room. They're in and out of jail quite often. They're calling 911, homelessness, health concerns.
But there are just tons of resources out there, but trying to navigate through them is very difficult if you don't have transportation, if you don't have a phone, if you don't have a place to live to store anything. And in the end, the community is actually paying out more money to support this person out on the streets.
I do a broad variety of things. I mean, a lot of the things that I do with people is I'll help people, get food, help people look for jobs, help people look for housing. I'll accompany them to doctor's appointments. I'll accompany them to probation, advocate for them.
I just feel like we all have had need at some point. And it's nice if there are people that are willing to do that you don't have to, beg for things, and there's support services that are easily accessible. A lot of our clients don't realize that the help is there. So a lot of our job is just helping them navigate through the systems to find the supports that they need.
It was on a Monday. I was down there at our place. She shows up, she says, oh, hey, she's telling me about how she could help me because I had a bad hip. And I was trying to get an operation done on it. She told me about, oh yeah, I got all this, I can help you, and she introduced how she's a community health worker for St. Pete's, and I'm thinking, wow, And I was sitting down, she never saw me walk before. And she, oh God, yeah, we're getting you in. I had a real bad limp. On Wednesday, I'm walking from God's Love over to our place. Colette's already got everything set up through orthopedic to have my hip looked at. And I went, holy cow, that was quick. Sure enough, went in that day and they said, yep, we took x-rays and everything. And when I was having my operation, the lady came in and hooked me up with an IV and gave me a shot and whatnot. I was in that room 5 minutes, I'm out. Next thing I know, I'm in a whole different room now. I had no idea what happened. All I realized was my hip didn't hurt.
That's what we're supposed to be doing, is helping people become independent, have productive lives. I mean, just in the 1 year we've been actually a little less than a year, the amount of savings and just improvement that we've seen has been astronomical. I don't have all of the numbers, but I know even people calling 911, that number has dropped with our clientele because they now have somebody else that they can call if it's just something where they want to talk.
If it wasn't for Colette doing what she did, I'd still be out there. There's no ifs, ands, or buts about it. Because I gave up.
If you're somebody who has suicide ideations, or if you're struggling with addiction or any of that stuff, just ask for help. That's the passion inside people that do this kind of work, or people that are in recovery, is they want to help people. That's what they're there for.
Ryan, I'm sure he has his own struggles and whatnot, but he seems so together, and wow, you were me at one point in time, really? I can do that? That's really big. And, without people like him, and I'd probably be dead right now, because I'd be on the streets and I'd still be drinking, and that's just game over. He's great. He's been a lot of help, put me in contact with a lot of good people. So, very grateful for him. It's nice to have somebody that I can openly talk to, that's been through the same thing, or can relate that, hey, he did it, I can do it.
And that's kind of where I feel my role is important, and where I can help is when a lot of times when people are down at their lowest, they just feel like there's nobody there to help them get out, and I can kind of be the person that says, hey, I know the way.
This is by far the best job I've ever had. I just get to be out there helping people. I get to go out and interact with people and help them out and be their spokesperson, because a lot of the people that we work with don't really advocate for themselves, or it gets to be difficult and it's easy to quit.
I can't breathe through my mouth or nose, I only breathe through it. It's called a laryngectomy. I had to separate my mouth from my airway, so I breathe through my neck, and I still eat and swallow through my mouth. It's not fun and it doesn't feel good. I felt like giving up a few times, but I haven't. Because I don't want to give up. I don't want to die. I'm afraid of dying. I can't even think of everything she helped me with. Colette, she helped me with my appointments and everything. She's like my real good friend. And helped me call in because I can't really call on the phone. It's hard to understand me with this electric voice. If they put me on speakerphone, might as well forget it.
What would your life be like without Colette?
Miserable.
I've had more than one, you know, where I talk to them and they're like, oh, we tried this, we tried that, it didn't work. And so I just quit. And like one of the gentlemen, you know, is homeless and he needed lots of medical care and he just wasn't getting it because he tried to make a few phone calls using other people's phones. And then because he didn't have a phone of his own, nobody could call him back. So he just kind of fell on the wayside. And so as medical conditions get worse, then you can't work and you just continually spiral downward. So for me, it's kind of nice if you can just pick up a few of those pieces. A lot of people can get back on their feet again and get going.
A gentleman that I just got housed in a broad way, I put a post on Facebook basically asking community members, because Helen is awesome for wrapping around and helping people. Just, hey, I was able to help an individual get housed that was homeless for 15 years. And you'd be amazed at how many people replied to that. Like, I'll probably be able to furnish his whole apartment.
Going from doing all that for those 5 years of being homeless, and then all of a sudden turn around having a place, you know, and I'm like, I don't have to worry about my hip. You know, where am I going to sleep tonight? Well, what, you know, am I going to get fed today? You know, where am I going to get food? You know, it's a life changer. Oh yeah, big time.
He is the embodiment of everybody that helps him to help me. You know, he is that person that I can never repay. He's helped me tenfold. He's a multiplying force, you know?
From experience, it took me 28 different facilities, whether that be treatment, detox, jail, prison. It took me 28 different times till I finally decided to change my life. Never give up. Don't give up. You're worth fighting for. And that's one thing that I try to tell people is don't give up on yourself. Like, you owe it to yourself to have a better life.
You just need to keep proving that you're going to be there to support them too. And I think additional support for them helps them through the path. That if they know that they can call you after they've relapsed for the 20th time, and you're still going to say, all right, I'm coming over. I think it's just really important that we continue to support regardless of how many times it's been. If they're still willing to try, I think we need to continue to be there and try to keep all the other supports in place. And I don't mind doing it. It's a very gratifying job.